Hi, we're Group 3B, and today we're going to discuss animal models of heart failure. So first, we're going to start with some statistics about the disease. Heart failure impacts approximately 26 million people worldwide, and in the US, they are considered to be 5.7 million people, expected to be 8 million by 2030. The treatment costs of the disease in the US in 2012 are about 31 million US dollars, which is 10% of the total cardiovascular budget. That number is expected to rise by 127% by 2030. Heart failure is a serious cardiovascular disease with increasing prevalence in elderly people. The term is used to describe the condition when the heart is unable to pump blood around the body properly, or particularly when the ventricles are unable to fill up and eject blood. It can occur due to abnormality in cardiac structure, function, rhythm, and others. It can also be a result of other conditions, including heart attack, hypertension, heart muscle damage, as well as if the heart becomes too stiff or weak. If the heart becomes too stiff, ventricles may be unable to fill properly in between heartbeats, which might cause further damage of the heart muscle and stretching of the ventricles. Here on the picture on the right, we can see a comparison between a normal heart and a heart with an enlarged left ventricle due to heart failure. Some of the most common symptoms of heart failure include breathlessness, fatigue and weakness, nausea, swelling of legs, ankles and feet, cough, irregular heartbeats, and others. Unfortunately, the condition is untreatable, but it can be controlled for years. This can help with relieving symptoms, slowing disease progression, reduce need for hospitalization, and generally improved quality of life. There are two mechanisms of heart failure, systolic and diastolic dysfunction. Systolic dysfunction occurs most commonly due to ischemic heart disease, idiopathic dilated cardiomyopathy, hypertension, and valvular disease. Diastolic dysfunction occurs due to the same reasons, but is more prevalent in women. Based on the left ventricular ejection fraction and the mechanism of the disease, it can be divided into a few subtypes. So here on the table, we have a summary of the types. We have left-sided heart failure, which occurs when the heart must work harder to eject the same amount of blood and fluid may back up into the lungs. Then we have heart failure with reduced ejection fraction, also known as systolic, which occurs when the left ventricle loses its ability to contract normally. Then we have heart failure with preserved ejection fraction, also known as diastolic, when the left ventricle loses its ability to relax normally. And then we also have right-sided heart failure, which occurs due to left-sided heart failure and can cause blood backing up into the veins. Animal models of the disease depend on the type of heart failure that is being studied. So animal models of heart failure include both small and large animals. First, we're going to discuss small animals. They include mice, rats, and guinea pigs. Small animal models are used to improve our understanding of the disease and help with the development of potential therapeutic treatments. They are established through genetic modifications, pharmacological and surgical approaches, or a combination of a few. The pathogenesis of heart failure with reduced ejection fraction and heart failure with preserved ejection fraction are different, so oftentimes they have to be investigated in different models. So I mentioned the pharmacological approach of developing heart failure in animal models. And here on the table, we have a summary of a few drugs that can be administered into the animals in order to achieve a toxic cardiomyopathy model. Depending on what the study is trying to achieve and what type of disease is being studied, the models are going to vary as they all have different advantages and limitations, and their limitations are mainly concerned with systemic toxic effects or organ toxicity and non-specific side effects. So one of the most common approaches to inducing heart failure is the surgical approach of producing left ventricular pressure overload. In mice and rats, chronic left ventricular pressure overload leads to heart failure. The most common technique of achieving this is through permanent transverse aortic constriction, or TAC. It increases left ventricle afterload, which ultimately leads to heart failure with reduced ejection fraction. This can be achieved through a few methods: small incision of the proximal sternum, impeding blood flow across the aortic arch, or a novel method of achieving this includes the placement of O-rings of the same size around the ascending aorta of mice. Following measurement of peak flow velocity across the right and left carotid artery allows quantification of the pressure gradient. The consistency of the constriction is maintained by using a needle of fixed diameter alongside the aorta as a guide. The severity of the TAC depends on the tightness of the constriction. Another surgical method that can cause pressure overload is ascending aorta binding. This method is executed by placing a structure around the ascending aorta in young rats. It causes hypertension, increases left arterial pressure, left ventricle dilation, and systolic dysfunction by the time mice reach the age of 18 weeks old. A limitation of using this model is the fact that the onset of pressure overload is immediate as opposed to the gradual progression that occurs in patients with heart failure. Another method that has been established for the development of heart failure in animal models is through inducing myocardial injury. The most common way of achieving this is through myocardial infarction. It has been found that there is a correlation in post-myocardial infarction, left ventricular dilation, and the function of the heart. Coronary artery ligation can be used to induce myocardial infarction. This includes the ligation of the left anterior descending artery, resulting in heart failure 4 weeks post-surgery and causing permanent occlusions. A newer approach to inducing myocardial injury is through ischemia reperfusion injury. It is a contributor to myocardial damage occurring during acute myocardial infarction. It allows the investigation of molecular mechanisms and tissue damage post-temporary occlusions and overcomes some of the limitations associated with the myocardial infarction model. This model is usually induced in younger animals. Another method of inducing heart failure that is relatively new and is becoming more common is using genetic models. They help study the impact of gain of function and loss of function mutations on cellular and molecular processes on clinically relevant phenotypes. A means of achieving this is through the use of engineered nucleases, which modulate DNA sequences and generate transgenic mice, which include TALEN, which stands for transcription factor, transcription activator like effector nucleases, ZEN, which stands for zinc finger nuclease, and CRISPR, which uses the Cas9 protein.
The importance of large animal models of heart failure in the development and testing of efficacy of new therapies cannot be disputed. Porcine, ovine, and canine models have all been used for this purpose. They are necessary in trials due to the fact that the combination of events and risk factors that lead to heart failure make finding new methodologies very difficult. Such events and factors may include physical inactivity, obesity, hypertension, type 2 diabetes, kidney disease, as well as age and sex. Large animal models in this instance are beneficial as they are more reliable in replicating physiological processes that occur in humans. In these models, we are able to clearly observe left ventricular wall tension, heart rate, and vascular wall to lumen measurements that mimic that of humans, which are all vital in the study of heart failure. There have been numerous large animal models of heart failure due to chronic pressure overload caused by systemic hypertension, as this is a prominent issue within patients with this condition. These models have also incorporated obesity, diabetes, etc. into the design and have been carried out using surgeries such as aortic banding, renal wrapping, etc. in the aforementioned animal species. It must be noted that these methods are effective but do not account for genetic factors that may affect human patients. Another cause of heart failure is myocardial infarction, the interruption of blood flow to a specific area of the myocardium caused by blockage of one or more coronary arteries, and in this instance, large animal models have been utilized to observe and follow the decrease in cardiac output following a similar traumatic event, as well as ventricular dilation, reduced thickness of vascular walls, the activation of neurohormonal systems, and reduced ejection fraction. It is argued that this type of model is underused. However, it cannot be said that this methodology of research is without its fault. As within many animal species, there exists a range of metabolic pathways that will result in varying levels of efficacy and toxicity. Animal species also have wide genetic heterogeneity that must be accounted for.
So I'm going to talk about the advantages and the disadvantages of animal models. First, by using animal models, researchers can perform experiments that would be impractical or ethically prohibited with humans. Using animal models in investigating heart failure has following advantages. So first, the small laboratory rodents are cheap, easy to breed, So large numbers of animals can be used. Furthermore, small animals are exposed to fewer criticism regarding animal protection. And second, some techniques can be used on these small animals, such as high-resolution echocardiography. And third, transgenic small rodents can offer the analysis of the significance of certain gene functions for the aetology and the pathophysiology of coronary heart disease-related heart failure. Besides small animals, there are also larger animals can be used. And compared to small animals, the larger animals have hearts that are more similar to human. So this is advantages of large animals. And then I'm going to talk about the disadvantages of animal models. So the disadvantages of animal models are shown below. First, usually animal models are developed on a certain genetic background. However, this genetic background does not reflect the diversity of human beings, which may lead to a variety of phenotypes from the same monogenic disorder. And second, in some acute intervention condition, such as coronary obstruction, may only mimic one single time point of a lifelong chronic disease. And third, there are also significant physiological differences between small laboratory rodents and humans. So here are some graphs that shows the differences between rodents and the human's heart. So first, cardiomyocyte action potentials of rats and mouse are characterized by a very short duration, normally lacking a plateau phase. The resting heart rate is about 5 times higher than in humans, and the force frequency relation is inverse. So these two differences are shown in the graph B and C. And then third, the calcium removal from the cytosol is predominant by the activity of the SRC calcium 2+ ATPase in human and rodents. However, the sodium plus in calcium 2+ exchanger activity is lesser relevant in rodents than in human.
The importance of in vivo models. In vivo models are essential to the understanding of a disease. Not only do they give us greater understanding of how the disease affects animals, but they are also key in developing new techniques and treatments on how to prevent the disease. This is because the models are crucial to how we understand the pathophysiology. By carrying out experiments in vivo, so within a living organism, it allows us to assess the treatment used and how it will affect humans due to the effects that it has on other living animals. By understanding the potential risks, we can therefore rule out or promote certain novel techniques to evaluate what is safe and effective to carry out further studies on humans in clinical trials. When studying heart disease, many different animals are known to be used in vivo models. These include both large and small models: rats, pigs, rabbits, dogs, mice, and sheep. The use of these animals gives us the most accurate results on what the treatments would do to human subjects, therefore giving us the best chance of developing a new treatment with the highest survival rate. When developing novel treatments of a disease, there are many factors which can affect the success of it. In vivo models are crucial as they allow us to predict potential interactions within an animal. This gives us the best chance of understanding three factors: safety of it, the toxicity it may have, and the efficacy. If we were only to use in vitro models before the use in humans, we would not fully understand the possible adverse effects that treatments could have on living organisms on a whole body system, as opposed to just the target cell. This allows us to predict the interactions on a whole living organism throughout the whole system. This will give us the best chance to create a candidate drug which has the best chance of helping with human disease and limiting potential side effects. In vitro models are useful, however, they only give us information on how a drug or treatment will act on a particular cell. However, it may not be safe to introduce to a whole living organism, as the effects on the whole body are unknown. In vivo models bridge this gap, allowing scientists to see how a particular drug may affect the whole body. By using these models, we can get the most lifelike results, so we can predict which drugs and new techniques would be most effective on heart failure. The type of techniques which could be used in the future include gene therapy, new surgeries, and other mechanical devices which could be implemented into an animal.
Okay, so I'm going to be talking about alternative methods that we can use as opposed to in vivo animal models for heart failure. So despite increases in cardiovascular research and development spending, there's actually been a gradual decline over the years in the amount of cardiovascular drugs being approved. And also, these drugs tend to cost about 0.8 to 1.2 billion US dollars to actually develop. So let's just discuss this figure down below. So from the years 1963 up to 2008, we've got the amount of drugs being approved and also the amount in billions of US dollars that are being spent in research and development. So from 63 up until 98, we see increase in the spending, which is matched with an increase in new drug approvals. However, up until the peak here at 98, which is about 40 drugs being approved, we actually get a decline back down to roughly 15 drugs being approved, which is back to what it was in the 60s, yet despite having the highest amount of spending, which is nearly 52 billion US dollars in that year. So why is that? Well, it's actually due to these unexpected side effects in clinical trials, which are due to a lack of effective and predictive models in preclinical testing and actually earlier stages of drug development. So reasons for model failures in drug development. These cardiovascular side effects that are causing these failures in clinical trials and so forth are generally caused by systemic toxicity and also metabolites, and these tend to be organism specific. So we can study it in a rabbit, but it's going to be different to what it is in a human. We also have differences in vivo dynamics between species, so humans compared to animals, and these are caused by metabolic and genetic differences. Moreover, drugs can benefit certain ethnicities, sexes, such as females or males, and ages. So when we test drugs in clinical trials, they tend to be in a small group, and this might not represent the broader society. So a lot of times we can get drugs that fail in clinical trials when it might just be that they only fail in that ethnicity, and they might, I don't know, they might be better in the general population, and vice versa. They might be really good in clinical trials, but that might just be, I don't know, it might just be females, and it might turn out that they're not very good for males and so forth. And also it's a long process and it costs quite a lot. So to resolve this, we need to test cardiovascular effects earlier, and also we need to do more than just Herd testing. So a lot of time, Herd testing can create false positives and negatives, which can be potentially serious. So they can cause potentially lethal drugs to enter the market with false negatives, and they can stop beneficial drugs with false positives. So solution, heart on a chip. There's a variation of these, but we're going to talk about hearts for the organ, which is on a chip, because that's the most appropriate for heart failure. So these involve microfluidic chips, which reproduce the mechanisms of the heart. The cells on these chips are cardiomyocytes, and these are derived from induced pluripotent stem cells. And from these, we can carry out in vitro studies into pharmacology, so we can test how drugs work on the heart, physiology to help understand the heart in general, and also pathology, so we could actually study what's causing heart failure in humans. And how are we able to do this? Well, the heart on a chip exhibits physiological characteristics of the myocardium. And it does this by having mechanical stimulation. It's got a similar cellular composition. It's anisotropic in organization, so it's directional like the heart. And also it enables interactions with cells, with other cells, and also with the extracellular matrix. And here, just to finish off, here's a figure of what the heart on a chip looks like, which I've taken from a paper. So in the top right, it's just zooming in on the green section, so we can see there's the extracellular matrix surrounding this core, and within the core you get cardiomyocytes, which are from these stem cells, and also cardiac fibroblasts. And these are being supplied with nutrients constantly by these blue channels. And just to finish off in the bottom right, it's just to show the actual size. So these devices are only tiny, and here it is compared to an American coin.